everyone. I'm Shelia Roundtree, practicing internist in South Carolina, and I'm also a 2003 alumnus of the Harvard University Commonwealth Fellowship in Minority Health Policy. Recently, I became a board member for Reede Scholars. The mission of Reede Scholars is to engage a network of diverse, skilled, effective leaders who will be effective through research, education, policy, and practice. One of our tools that we use to accomplish this goal is our periodic podcast. Today, I'm overjoyed to speak with my dear friend and classmate from the fellowship, Dr. Bisola Ojikutu. I remember very well the first day we met in 2002. I was immediately affected by how gorgeous she was, but also very clearly brilliant, focused, and a person who would not be deterred. Mm-hmm. Indeed, she's accomplished all her goals and more. She's on a mission to improve health for communities locally, regionally, and internationally. Dr. Ojikutu is a nationally recognized physician leader, health equity researcher, community advocate, and expert in prevention, care, and treatment of infectious diseases. She's a graduate of the Johns Hopkins University School of Medicine. Currently, she serves as professor of medicine at Harvard Medical School and also as a faculty member with the Division of Global Health and Equity, Brigham and Women's Hospital, Boston, Massachusetts. She's a widely published author, scholar, teacher, and I'm really blessed to be able to call her a friend. Bisola, hello.
Hi, Sheila. It's so good to see you. I am really honored to be here and to be able to have this opportunity to share anything that I can that will be helpful to folks who listen to this. I just want to say that, Sheila, honestly, I was very impressed with just how warm and caring you are and how well you sort of balanced, because you had a family then too, how well you balanced fellowship and your drive for a career and your drive for knowledge with all the other things that we were doing. And it's a lot of pressure. And I'm really happy to see you and see that you have, achieved so many things. So it's good to see you.
Likewise. Well, you were very helpful then and now. Well, and I know you're busy. What kind of work are you doing exactly? And I'd be curious to know how we out in the community as physicians, lay people, just people who care, can advance this important work. And I have the feeling that now our caring and our preparation, education, training, and just our humanity will be more important than ever. All ears.
I totally agree with you. I think our work is more important than it ever has been at this moment in time in our history in this country and in the world. So I am the Commissioner of Public Health for the City of Boston and the Executive Director of the Boston Public Health Commission. I can tell you a little bit about how I got there, but what I will say is that just give you a little bit of background on the Boston Public Health Commission. So that's our city's health department. It is the oldest health department in the country. It was actually first incorporated as a board of health in 1799. And our first commissioner, if you will, was Paul Revere.
Wow.
Right. So no, I know, right? So, not only did he do his historic ride, he actually was a proponent of inoculation very early, infection control, quarantine. He was a dentist, very interesting man who I didn't really know all those details about him. So, as a health department, we are about 1,400 or so strong. Our mission is to work in partnership with communities throughout Boston to promote and protect the health and well-being of all Bostonians, but especially those impacted by racism and systemic inequities. And this is a mission that we really just reestablished recently. We had a very basic mission, but we really wanted to focus in on this issue of addressing inequities around our city, and if we can, have an impact even beyond our city. So I became the commissioner in 2021, and it was sort of still at the height of the COVID-19 pandemic. And it was, sort of trial by fire, sort of jumping in there to get a lot of work done in terms of getting people vaccinated. We also were in this situation where a new mayor was coming on board, and we have to always think about the political context. And we're very lucky to have a Mayor Michelle Wu, who's very progressive, very strong in regards to her beliefs regarding health and wellness. And she's been very supportive of our work as a health department. I say that also just to tell folks, if it's young people or trainees who are listening, that it is really important to know who your boss is. Right?
That's right. That's right.
What do they believe in, and who are they, and are they really going to be supportive of your work? Otherwise, it's very difficult to get anything accomplished. So we're very lucky in who we have as our mayor. And I recall when I first started, and I talked about what the priorities were for our city, and where, I thought, we needed extra work, where she, thought would be a part of sort of her agenda. And we listed, 4 or 5 things. And at the top, of course, was the ongoing COVID-19 pandemic and what we were doing. So that was obvious. But next, it was really about issues related to inequities. What are we going to do about the disparities around our city? I mean, you look at life expectancy. We have a huge life expectancy gap in the city of Boston, actually 23 years between a small area in Roxbury, very near Harvard School of Public Health, and a small area, the Census Tract in Back Bay. So there's this huge life expectancy gap, which I'll talk about in a second. But also on that list, youth mental health, because, we're in a global, I would say, youth mental health crisis, but certainly when it relates to youth, it's certainly impacting what's happening in our schools and all the things that we know are just critical as we think about how to prepare our children for the future. So the youth mental health crisis was on our list. We also have on our list that within public health, as you know, as a healthcare worker, that within our workforce, there's just morale low, you know what I mean? Especially,
Low.
yes,
Low.
especially coming out of COVID and just a lot of what's happened. It's continuing to evolve. And certainly that's impacted both our healthcare institutions, our hospitals, our clinics, as well as our public health department. So that was also on our list. How do we build a stronger workforce, So these were the things that we sort of looked at. In addition, and this is also another thing that I know you know very well, substance use disorder and homelessness, and the intersection of substance use disorder, homelessness, and mental health issues just around our city. At the time when I started, we had 2 significantly sized encampments, like camps where people were living, and a lot of danger in those areas, in that there was, ongoing open air drug use, drug dealing, human trafficking, just sort of all sorts of things that were happening, making it very dangerous. So those are really the top 4 things. And there were others too. Certainly we want to, work on environmental justice and lots of other things, right? But those are the top 4 things that we wanted to move forward with. And so since being in this position, I think we've made significant strides in each. And I think that has been my goal. And hopefully by the time I'm sort of done with this job, and I don't know when that will be necessarily, but when I get there, I will be able to say that we've, really put forth a significant effort to tackle each one of those.
Yes. Yes.
And so I can tell you a little bit about each, and then I'll pause and, we can
Please
talk more.
do. Please.
So, with the health inequity piece, with the life expectancy situation. So I told you that there's this 23-year life expectancy gap. But even if you look around the city, Sheila, I know you know Boston well, there are areas within Dorchester, areas within Mattapan, areas even within Jamaica Plain, and even out in Alston Brighton, neighborhoods that are further away, where we have significantly lower life expectancy than average life expectancy in the city.
Wow.
And average life expectancy, nationally. And so the question for us was why? What exactly is going on? So if you look at our data and you take that gap, so I said 23 years in gap, and you do what's called decomposing the gap, meaning you pull it apart so you kind of see what are the diseases that are contributing the most life years lost, and who is it who's dying. So looking at our gap, what we see, if you just consider the number of years that life that's lost, we're really talking about three issues that are contributing. And one, cardiometabolic disease, so heart disease, diabetes; two, preventable cancers; and three, substance use disorder and overdose mortality. So those are the three sort of disease entities that are causing a problem. But when we look bigger picture and think upstream, what is happening upstream in communities, what is causing these folks to die early in a city where 96% insured, we've had full expansion of health insurance coverage. We have a city where we have 22 community health centers, beautiful health centers, and we have major health institutions like Mass General Brigham, like BMC, like all of these other, major Boston Medical Centers, BMC for those not in the area. So we have a lot of healthcare resources, but it's not just about healthcare resources, right? It's what's actually happening in communities that's really what's important. So,
and access to those.
Yes, exactly. You really have to think about what's happening in our communities. And what we've looked at is just the fact that we have communities where there's been chronic disinvestment. There's been redlining and there's segregation where people are, separated, and there's just not a sense that these are thriving communities. And it's maybe small communities, but little small areas, but not quite thriving. So housing isn't what it should be. Transportation isn't what it should be. The built environment, parks, roads, all the things, increased violence in these areas, as well as lack of, economic mobility. So all these factors contributing to what we're seeing is these downstream outcomes for a lot of people. And so we wanted to tackle that. So what we did was we launched an initiative called Live Long and Well, and we launched it earlier this year. It took a while for us to, really think about where the money was going to come from. And we have a $10 million investment that is going towards our efforts, which is great. It's not enough, but it's great.
Quite a start.
Yes, it's a start. Exactly. It's a start. And we're calling it sort of a catalytic investment, in that we're hoping that other people will join on board. And so we are issuing an RFP in December where we'll be looking for community-led coalitions of individuals who want to focus on developing multi-level interventions to address this issue of life expectancy gaps. So that's one area where I think we've made some strides.
Exciting.
Yeah,
it's
exciting. Absolutely. And so, it's interesting. I was at the American Public Health Association meeting a couple of weeks ago, and at the meeting, we led a session where we brought together a number of cities. So we brought together New York City, San Diego, Minneapolis, and Chicago and Boston to talk about these life expectancy gaps. And everybody's dealing with the same thing. Everybody. So it really is an opportunity that we're going to work on, actually, to work together on this. So we're going to try to start a national network of cities where we're all sort of working together to look at these issues, think about our data, think about the interventions that we want to put in place, think about advocacy, think about campaigns, like how do we get the word out about these issues? So that's something when you say, how can we help? I mean, these are things where, our network of Reede Scholars, other people, can certainly be involved. So I'll tease that a little bit. And then, at some point in the future, we'll come back together on that.
And may I just say that I didn't expect to hear a 23-year life expectancy gap. That is beyond my wildest imagination. 23 years. Yes,
it's very disturbing. So in Back Bay, life expectancy, there's a census tract where life expectancy is 92 years, life expectancy at birth. And then this census tract in Roxbury, it's 69 years. Yes. So that is a lot. It is a stark difference. But interestingly, when we were in Boston, when you were also in Boston, the life expectancy difference that they calculated at that time, which was 2003 to 2007, using that data set, it was actually 33 years difference.
Oh, wow.
Yeah.
My goodness.
Yeah. So it's a long-standing, persistent issue, and it's one that we're hoping to tackle. Certainly, we can't do that alone. It's obviously a lot of different players across our city government and, multi-sector. It has to be
Yes.
beyond that, the hospitals and the community health centers and whatnot.
Yes.
So one of the other initiatives that I mentioned was youth mental health. And so we really wanted to tackle that. So starting in 2021, we started to plan to open up a Center for Behavioral Health and Wellness within our public health department. And so we did that, and we hired a chief behavioral health officer, Dr. Kevin Simon, who's also a former Commonwealth Fund fellow.
Yes.
Yeah. And so we opened that in 2022, and that's great. I think it's important to say that we have that established, but what is it that we're actually doing? So we were able to pull together a sum total of $21 million to focus in on youth mental health. So we have an initiative we're working on with the Boston Public Schools to develop a trauma-informed school system. So essentially to train all the faculty, all the, workers at Boston Public Schools, how do you provide psychological first aid? How do you intervene when you see emotional dysregulation amongst kids? What do you do? Yeah, so that's a big initiative. We're also working with one of our universities, UMass Boston, to train diverse, linguistically, culturally, racially, ethnically diverse providers to treat and provide counseling and support to young people. And we're training them under the condition that they will stay in Boston. Because as you know, oftentimes people come to Boston and, we don't have enough of the resources that actually stay in the area. So those are two things that we're doing with mental health. And we're actually launching a citywide youth mental health campaign very, very soon, where we'll try to lower the stigma, around mental health and make it clear to kids that they can reach out, get help, either from other young people or younger people, but also breaking down the barriers between kids and adults in terms of their mental health. So that I think is a really big thing. Yeah, no, I'm very excited about that. And then lastly, I'll mention that one of the things that we're doing in healthcare workforce is that we were able to get a grant from the CDC. It's about a $9 million grant where we're really looking at building morale, building professional development, enhancing and diversifying our public health workforce. So it's a 5-year grant, and it's something we always wanted to do. When I started, I really wanted to focus in on how do we retain people in this field? You know what I mean? How do we maintain the kind of workforce we want to maintain within the health ecosystem in Boston? So we're spending a lot of time, effort, and energy thinking through sort of our best practices and trying to improve how we even look at the culture of health and the culture of our healthcare workforce. Trying to increase morale, as well as increasing, as I said, diversity as we move forward. So those are just some of the things that we're working on, and hopefully we'll end up being successful.
It sounds like you're already highly successful. I know that, and I'm so proud of you all and what you're doing. In the clinical world, there seemed to be a mass exodus of practitioners during COVID. You saw this in the public health realm also.
Oh, absolutely.
I see. And any words of encouragement? Climate change, we may be in the midst of a tremendous political climate change, but do you agree with me? We will stay focused and we will get the work. We'll get it done. We've always, this is not the first time there's been a climate change. We're going to dig in harder, deeper, and get it done.
I think you just said it, Sheila. You just said the words of encouragement. That was great.
We have to do it. And I guess we have to, even in a difficult overall situation, there will be people who care. And we have to find them and bend their ears and make these realities matter for them.
Yes.
Everyone is not heartless. We have to find moderate people who will listen and who at the end of the day will do what is right. I'm in a different region of the country that can be challenging, but even here, there are people who care.
Yes, no, of course there are. Of course there are people of all, races, religions, whatever.
That's right. That's
People,
right.
people, people care. And even when you think about Boston being somebody say it's in a little bubble, like
Mm,
we're okay. The reality is that there are many people within our bubble who can be adversarial. So I
I
think
can imagine.
everywhere there's going to be challenges, but like you said, we dig in, we are resilient, and we will continue our work, and we'll probably come out stronger at the end of the day.
We will look forward to that.
Yeah.
And what we have to do in my area is somehow find a story and appeal to the one person who will listen and
Mm,
make or one or two people and make it personal for them.
mhm.
And so this is what we have to do so
That's
that the
right.
work won't stall. I
Mhm.
cannot wait to talk to you again. You are
Yes.
doing so much, accomplishing so much, which is typical of you. And
Thank you, Sheila.
thank you for this. Thank you for sharing. Any final comments, words of encouragement or thoughts?
I would just say that follow your heart when you're thinking about what it is you want to do with your career. If you're in the stages, I talk to a lot of young people. So if you're in the stages where you're trying to think about what it is you want to do, really follow your heart. I sometimes run into young people who sort of, are thinking, oh, well, it'll be too hard to do this, or, maybe I won't make enough money doing that.
Mhm,
But I would
mhm,
just say, there's so much out there that we can do to create change and to make
mhm.
things better for all people. Really
Okay.
follow that. Exactly. Follow that passion. And I think, it'll always do you right at the end of the day. You
That's
will
right.
always, you will always come out on top at the end of the day.
Oh my, well, my dear friend, you are on top. And as a result of listening to you, we're a lot higher. Thank you. Can't wait to see you again. And please do
Yes.
join us again and enjoy the holiday season.
Oh, you too. You too. I hope your family is safe and healthy, and have a wonderful holiday.
You as well, dear. Your Aunt Bisola. Don't forget. Okay. See you
Take
soon.
care. Bye
Thank you.
bye.
Bye bye. Thank you.
Thank you for listening to Reede Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.